Thank you.
So where does it all stand, and what does it all cost as of right now?
Let's talk to two congressmen in the thick of the political action, Democrat Dennis Kucinich of Ohio and Republican Michael Burgess of Texas. Good to see you both. Representative Kucinich, where does it stand? I mean, we're looking at a situation now where we're watching them try to mush together, it's a very scientific term, these bills and try and get something put together. What are you hearing and what are you seeing?
Well, there is a real effort in the House to keep the public option in play. And the size of the public option is really going to be significant. How many people could possibly be affected by it? In its first iteration, the public option would have covered 129 million people. That would be a real bargaining chip with knocking down insurance company rates. But if it's a small number, it may have less of an effect. In any event, the public option is still actively being considered in the Democratic caucus.
Congressman Burgess, is it your contention, as I know a lot of Republicans say, that this is just a step to universal health care?
Well, you know, the bigger problem right now is the Democrats can't satisfy themselves on what this public option means to the country. My personal opinion is it's not a good idea. But if it's such a great idea, they have the votes. They've got a 40-vote margin in the House. It's incumbent upon them, no pun intended, to bring it forward. Yeah, is it a slippery slope to a complete takeover of the government by our healthcare system? Sure, in my opinion, it is. People will argue the other way. Dennis wants he wants competition in the insurance market. I do too, but I want a lot more than just one other option. I want to open up the market so that there'll be multiple companies competing for an individual's insurance business, and yeah, let's let them compete across state lines.
Well, Representative Kucinich, why don't they do that? And do you too agree that we should have multiple choices here?
Well, I have an amendment that I put in the House bill that would let states be able to choose a single payer option and pursue their own the health care destiny of any given state. And I still believe that should be done. As a matter of fact, my good friend Congressman Burgess knows that I'm for a single payer, which is the ultimate public option, which takes profit out of health care and covers everyone. I mean, I think that's what we actually ought to do. But whether or not we're going to do it, Mr. Burgess is right. I mean, this is really up to the Democrats to make this call.
Well, let me bring back Mr. Burgess. It's actually Dr. Burgess. We should have mentioned he's a medical doctor. But Congressman Burgess, do you think that single payer, at least Dennis Kucinich is honest about it? I mean, there are a lot of Democrats who may, in fact, have that as their end goal. He comes out and says that he wants that. Would that essentially destroy the insurance companies in the United States?
Look, single payer is a bad idea, whether it's the government or United Healthcare. I mean, it doesn't matter. Single payer means there is no competition. It's take it or leave it. It's take it or leave it for the patient. It's take it or leave it for the physician in the hospital. Single payer is not the way to go in a country that prides itself on allowing lots of choices. We should be about creating more choices for the American people, not fewer choices. We shouldn't be looking at restricting access. We should be looking at expanding access.
Congressman Kucinich, can I get back and just sort of push you on the crossing the state lines issue? If we don't get the single payer, which you would like to see, let's assume that that is not happening, at least for the moment, would you at least be supportive of people being able to cross state lines with the insurance plans that they want?
Well, you know, frankly, right now, the way that we need to go is single payer at a state level, and that's what I propose.
Would you support, though, if it were the only choice put in front of you about crossing state lines? Would you support that?
What do you mean by that?
Well, allowing people to take their insurance with them if they move to another state. Let's start with that one.
Well, there should be portability. There's no question about that, and in some plans do have that. But we have to go beyond that. I mean, we have 47 million Americans without any insurance, another 50 million underinsured. You know, my friend Congressman Burgess, I'm sure that he has the same concerns about what about these people who are uninsured and underinsured. I have a plan that would deal with that, and I'm hopeful that the House will keep my state single payer initiative in there, at least to be able to enable people at the state level. The states are the microcosms of democracy. But the laboratories, they ought to have the chance to pursue their own destiny if the federal government doesn't come up with a plan that they consider viable.
All right. Well, Congressman Burgess, what about that? Let's throw the gauntlet to you. If, in fact, we have what Dennis Kucinich wants, we get a chance to see whether single payer works, at least from state to state.
You know, it's been such a failure when it's been tried in other countries, but But look, if you have the robust public option the Democrats are talking about, that's going to be a federally subsidized insurance that is available in every state. So we're already saying we can sell across state lines if you just go the direction of the federal government. All I'm saying is, look, you have an NFL player traded from one city to the next, his insurance goes with him. If you have the fan that travels from one city to follow their favorite NFL player, they got to start all over again. And if they've had a tough medical diagnosis in the interim, then they're frozen out of the process. That's the part we ought to be fixing. That's the part that's driving people crazy. The 8 to 10 million Americans who, through no fault of their own, find themselves in a situation where, yeah, they'd like to be insured, but they just can no longer be insured because of the problem with pre-existing. There are ways to fix that without going this direction of a full-on government takeover and without taking liberty from the American citizens by forcing them to buy insurance.
Would you agree, though, Dr. Burgess, and of course you've been in medical offices and emergency rooms, that the insurance companies have already come between a patient and his or her doctor? I mean, this is suddenly they're saying that they are.
Nope.
Right. I mean, this is an issue that suddenly the insurance companies are looking like Mother Teresa when in essence they've been less than that.
No way I'm going to apologize for the insurance companies. They've brought a lot of this difficulty upon themselves. But if you go to Dennis's world where the government pays all the bills, remember Medicare and Medicaid, the two biggest public options we have right now, don't pay the freight for the care that they require people to deliver. So you can go broke trying to run a medical office off of what Medicare and Medicaid reimbursements are now. We require the subsidization of the private sector in order to keep the public sector afloat. What happens if we cut down the amount of that the private sector brings to the table? It's just going to be that much more difficult to make ends meet in the different practices.
Well, on turnabout's fair play, Dennis Kucinich, to you, I was just talking to a Harvard investigator who has looked at corruption in Medicare and Medicaid, says it's far bigger than what anybody had ever thought. He thinks it's in the hundreds of billions of dollars. You have to admit that even though Medicare is seen as a solution or something like it for the current problems, there's so many problems with Medicare and Medicaid that to jump to another system like that might be disastrous.
Well, the problems with Medicare and Medicaid certainly have to be dealt with in any event. But the larger problem here is, what do you do about people who don't have any health care and people are underinsured? I mean, something like 62% of the bankruptcies in this country are connected to people not being able to pay their medical bills. We have a social and economic, even a moral problem here. And the fact is, there is corruption in that program. Well, we've got to get to the root of it. But there's corruption right now in the fact that you have insurance companies are making money not providing health care. 22% of the claims for the top 6 insurance companies are denied. They make money not providing health care. People cannot get the care they need. You know, I was in Cleveland over the weekend, and I saw my constituents. You're starting to see people, they look like they're falling apart. They're not getting the care they need. They don't have access to care. This is something that we really need to do as a country. This is a moral obligation, and I think that single payer is the only way to go. But, you know, I'm ready to compromise at least to try to get more people covered.
Well, we'd love to have both of you back because this is a great discussion, smart people, we really appreciate it. So we'll definitely have you both back, Representative Burgess and Representative Kucinich.
Good to see you guys.
Thank you. Well, have you heard about this talk?